We'll record this and then we'll put it up on the site once it's recorded. Um, so welcome to, we're just going to try to update everybody on what's going on. We haven't met in a little while. As everyone knows, we've seen a marked increase in cases and exposures in both counties during the last month and a half. And, you know, we've been sharing the numbers. I do a report every Thursday. And after I complete the report for both counties, I send it to Michelle, who puts it on the site. The last report was done on Thursday afternoon. And at that point in time, we had 50 cumulative count of COVID cases for people we supported, 84 for employees. And out of 189, or out of 304 people eligible for the vaccine at that time, for the people we support, 189 had it completed. Some of that hasn't been done because of either the house is on quarantine or isolation in most cases, or in some cases, people, families chose not to have it done, but the majority were because that site was in isolation or quarantine at the time that we were scheduling appointments. So Lori McGrath in Jefferson and Karen Jarvis up in St. Lawrence both keep track of that and try to schedule people whenever the slots become available. We know that they're going to become more and more difficult as the number of people eligible to get the vaccine has expanded. The good news is part of that expansion is people with disabilities out in the community who live home with their families are now eligible effective Monday, the 15th, to have the vaccine where they were not before. So that's good. On the employee end, we're not doing as well as we are on the people that we support. We have, out of 761 people that were eligible on the last report, 254 had it done. So we're about 52% of the people in St. Lawrence that were eligible have completed it. And in Jefferson, it's probably in the 20 something percent. Totally together, we're in the 30s. So we're doing some things to try to promote that. The nurses have done a PowerPoint. They've done some forums with staff to try to reduce the anxiety related to the vaccine. The other things that we're doing is we are paying, we're giving people 2 hours of administrative leave if they can't get it done during work hours, and have either taken time off or done it after work. That'll be provided to them on their paycheck after the second vaccine is completed and validated. We're now looking at doing another promotion. We're going to be doing drawings for those people that are eligible starting next week. We haven't even put that out yet to our staff. I'm going to be putting something out tomorrow. So we'll do 5 drawings in each county for anyone who's completed at least the first part of the first shot. And that'll be running for 8 weeks. Hopefully that'll be an incentive. And then Lynn and the group are doing some other incentives and some recognitions and some unique things, try to promote getting the vaccine. I actually had it done last Sunday. I'm 65 now, so I was eligible. Not that big of a deal.
Stop bragging.
98 staff have received the second dose and 70 people supported have received the second dose as of last week. Unfortunately, we have had 1 death in St. Lawrence County related to COVID and 1 potential in Jefferson that was related to COVID. So, you know, it has hit us here in Jefferson, St. Lawrence County. I think totally in the state, about 550 people with disabilities have passed because of COVID. So as a result of that, we have continued to limit visitation to our residential sites. Those are limited to only the essential workers at this time. We are not allowing people that are support staff to go in. They can drop stuff off at the front, but that's about it. We're not allowing family members to go visit at this point in time. I have allowed some families to, the person to visit their family in their home. They've called me, asked questions about, you know, what's going on. I asked them questions about not having other visitors in the location? Have they had their vaccines yet? Are they going out in the community, being exposed to others? And we've had limited numbers of people that we've allowed to go home for short periods of time. We'll continue to monitor that closely. If a house has a quarantine and isolation, that would stop it immediately at that point in time. The other thing that we're doing to try to limit exposures is we put into place all staff that work in a direct capacity have to wear a face shield and a KN95 mask during their shifts. We have allowed them they can purchase if they want medically acceptable eyeglasses. We just put that out the other day. Some people are having difficulty with the face shield. As long as the eyeglass meets the specifications that the nurses put out, then that'll be allowed also. Our workshops have continued to remain open because they're limited in size, the number of people there, and they're spread out enough for the social distancing. We also, again, promote the mask being worn and face shields. Our Ogdensburg location did close for a week. We did have a minor exposure up there, but things are going well now. Our federal contracts have continued to operate as normal. We have had a few bumps at Fort Drum where someone was exposed. We had to take 6 people out of work for 14 days. The Army wouldn't let them on base, but we got over that and we've been managing it pretty good since then. So we're going to evaluate every 30 days the issue with the KN95s, the masks and the glasses to see if we need to pull back, if we can pull back, as well as looking at visitation increasing if the numbers start to go down. So our community outings, as the Minor Street Group can tell you, are limited at this point in time. We're trying to limit those to medical necessity only. They allow for van rides to go out and for drive-throughs, but we try to limit people being exposed in the community now because of the high levels of community exposure. And we continue to provide Article 16 clinic services in both counties, and those are people being transported to those either by the house or by the agency in a very limited basis, so they're not exposed to a variety of people. Staffing continues to be challenging. We're at about last report, I think we're at 32% vacancy in Jefferson and 16% in St. Lawrence. Our staff continue to do an amazing job in providing a safe and healthy environment for the people we support. We've done fairly well overall, but we have seen an uptick recently. Hopefully due diligence will allow those numbers to go down and we can get back to some form of normalcy. We did recently reopen, or I think it was today actually, reopen Canton up Dahab, and we'll continue to look at those sites on an individual basis, and maybe we can reopen them in St. Lawrence County when we can get back into the state operative facilities and get Norwood, people back into Norwood that normally attended that program within the capacity restrictions and making sure we are safe. So a couple items to note, the renovation project, Gaffney Drive, continues to go very well. We're about 60% complete with a target date of completion the first week in July. We are, for those people in Jefferson County, we are selling bricks and you can personalize those bricks. They're going to be a path around our sensory garden. And I'll have Michelle talk. Michelle's on here, I think. Michelle, you want to come on and talk a little bit about that?
Hi, sure. Hello, everybody. I see a lot of familiar names on tonight, so it's good to see everybody's faces. So we are selling bricks and anyone can buy them, actually St. Lawrence or Jefferson County, or, whether you're in Korea or Italy or wherever, if you want to buy a brick, you can buy a brick. You can do so on our website at thearcjslc.org. There's a link to do that. The funds raised from this will directly go towards the renovation project. And if we sell out of all 300 bricks, then it'll be $24,000 contribution towards the building fund. But we have to get them all sold by March 15th. So we would really appreciate your support. We have raised, we're about 150,000 shy right now of our $3 million goal. So selling the bricks along with any other donations from family members or people in the community would be greatly appreciated to help us get to our goal, because every dollar that we save not having to spend on the actual project itself is one more dollar that could go into programming. So your donations are really appreciated. And you can reach out to me at the foundation office or through our website.
Thank you.
I'm not into sales like Michelle is, so that's why I had her come on. So just a couple things, projects that have been going on. We just installed a new generator up in 6 Commerce Lane, which will be a great backup for IT and needed for, if we need that site for emergency placement, we could do so with the use of the generator. We're also looking at updating. We've done a lot of updates in St. Lawrence County because we pretty much have done it in Jefferson in regards to IT and rewiring. We spent probably in excess of $600,000 in the last year in upgrading residential sites and our day programs. We're looking at doing more. So we're looking at right now, a variety of the major locations being rewired and getting ready for a new phone system, as well as increased bandwidth for our utilization.
Dave, I'm listening to Howie.
So the other thing that we
We're
are
not talking.
in the process of just about finalizing is additional work for both Jefferson and St. Lawrence is a repackaging project I think we talked about before. The number 5, number 10 cans of fruits and vegetables and soups. We're going to be starting that very soon. We're pretty close to getting ready to start implement that. And it's going to start in Watertown and hopefully expand, and we'll be able to bring it up in St. Lawrence also. You want to give any updates on the work center, Lynn? Either one?
Nope, I just,
Okay,
everything's going well as Howie mentioned. Am I unmuted, Howie?
you're good.
Okay, just that we had the outbreak just before the holidays, but everyone did an amazing job. Just keeping it contained as best as we could. And as Howie mentioned, we do have the packaging product that we do hope to expand up in St. Lawrence County, and it'll be a great work opportunity for people who are looking for a job.
The other thing up in St. Lawrence is the Michelle Quinnell Gale put in for a grant for downtown Canton revitalization. And we're looking at replacing windows in our 110 Main Street or 101 Main Street site down there. It's going to cover 50% of that cost. We are, a variety of us have been working on the FEMA grant. It's a ton of work compared to some of the other grants that we've done. And we're pretty close. I've got a meeting tomorrow with them. Actually, we've got about $121,000 we're putting in for. It was a 75% match to that. And it looks like now I saw something today that they're looking to pay 100% of it. So whatever they accept on that grant, that'll help us out tremendously. We also applied up north in St. Lawrence. We've been successful with public transit to get CARES funding to support that. And we're doing the same thing down here in Jefferson. The city of Watertown has a $3.1 million CARES Act grant. We're looking to get some support from that to support our 5310 program, our to from transportation. They'll look to cover some of your costs that you had in place during COVID. And we're looking at about $138,000 there also. The 14C survey I've talked about, that's the 14C is the Department of Labor certificate that allows us to pay sub-minimum wage based on productivity. It's been a topic at the federal and state level about being repealed at some point in the future, which would, eliminate some jobs for people with disabilities. So the ARC in New York, the Executive Directors Association has worked with the Alliance and with NYSED to put out a survey. We just got the results the other day and compiled it. We've got some great information for advocacy. So We're getting ready to develop our advocacy points to meet with both state legislators and with their federal representatives regards to ensuring that the people that we support will still have a place to work if the 14C is repealed over a period of time. So I'll let people know more about that as we move forward, but at this point in time, it's something down the road a ways. But I just want to make sure you're aware that that's out there in the environment, and it'll be challenging. There are some providers in New York State. There was, I think, 24 that responded to the survey that are huge and provide jobs to a lot more people than we do in regards to the 14C certificate, which would hurt them tremendously and increase the costs and also hurt our ratios with Source America and NICED. But it really comes down to choice. This is what the people we support want. They want a paycheck, they want to work, and we want to support them. The other big issue I want to talk a little bit about is the budget. So the New York State budget, there's a variety of issues. As you know, the federal government or New York State's budget is kind of, it's dependent. It's very opaque. It's dependent on what the state anticipates getting for federal assistance. It's either $6 billion or $15 billion. And the governor's put out, kind of a scenario of budgets based on what happens. Right now, for the 10th year in a row, he has deferred the cost of living adjustment, which would normally be a 50% match with the federal government. So we have not received the cost of living adjustment in 10 years, except for 1 year we had 0.2%. So other than Be Fair to Direct Care dollars, which have helped our DSP category staff, the agencies have received minimal to any increases in funding. The other thing that's out there is a potential of a 1% Medicaid cut. So that would be very difficult for the organization based on where we're at and the limited amount of resources we've had over the years. Also, there was a 20% withhold for any program that was 100% state funded. And they have, the good news is they're going to go back to the third quarter of 2020 and pay us back to 15% of that which they withheld, but they're going to continue with a 5% withhold into the 2021, 22 budget. They're also looking at, so for a residential program, one of the things they're looking at right now is what's called RRR funding. So that's funding that provides you with the money for maintenance of all your residential locations. It's approximately $600 per person. And they're looking to end that and go to what they call a prior property approval process. And with the prior property approval process, there's a certain level you have to reach to put in for it for a renovation. And the other thing is, depending on the size, you have to put the money up front for those renovations, and they spread the cost over a period of like 20 years and pay you back in your rate over that time period. So we're not looking forward to that one either. The other thing is the care coordination organizations, they were cut in July of 2020 by 16%. They're looking to cut them another 23% in this budget year. So that would be rather devastating to them also. I'm going to see if I can share my one screen. Can you guys see that?
Yeah.
Okay, so this is an organization, New York Disabilities Advocates, which was formed last year for all the providers, OPW, OMH, OASIS, Office of Alcohol and Substance Abuse. So they all have some commonality together when they're looking at issues with New York State, with budget being one of them. These are their legislative priorities. So again, they're looking at the cost of living adjustment to be restored. Restore the 1% targeted cut to Medicaid programs, restore the 5% withhold for non-Medicaid local assistance programs. They're also looking to, so some of the cuts that New York State's looking to do, like the Medicaid cut, is a double-edged sword because they're losing the 50% match from the federal government, whatever they cut in New York State. One of the things they are looking at doing, which may help us, is this was a suggestion from a group out of the Arc of New York, which the state adopted. There are a lot of kids out in residential schools outside of New York State, which are very, very expensive. And when they age out and they can't find placement for them, they have to stay in that residential school until placement can be found. It's about $250,000 a year, 100% state funded. There's no federal match for that. So what they're looking to do is looking to have some of the people that live in state operated facilities move into voluntaries where we have openings, and then backfill them with the children from, or the adults from the residential schools. They expect to save over $1 million the first year in that process. So, or 8 million, excuse me. So that's good news for us. We have about 11 vacancies right now between the two counties, and it would be assistive for us to fill those. Because the other cuts that took place in July, there's good news, bad news here. In July, we were looking at the vacancy adjustment for residential. Prior to July, what they would do is give you up to 5% of your vacancies they would pay you because your fixed costs remain the same. They eliminated that in July. And they also eliminated, they only funded 50% of therapeutic leave. So when people go home to visit their family members, we normally would have gotten paid as long as it was in their plan. We now will get paid only 50% up to the 92 visits allowed for therapeutic leave. And then there's what's called retainer days for hospitalization. We used to get paid when they were in the hospital because we're holding their bed. Now only get 50% of that. The good news is they rescinded that, and it's not going to be going into place until May 1st of 2021. But we'd like to see that eliminated because that cut right there is over $800,000.
Wow. So Howie, are you saying that therapeutic rate leave cut is going to be delayed until
Yep, it's been delayed till May 1st.
May 1st?
Yep.
I called everybody on that list.
Yeah, some of the advocacy has really helped because that's one thing that changed. That was rescinded. The advocacy related to getting people with disabilities living home with their family members, getting them put on the vaccination list. So there's been some good things done with advocacy. We are setting up this week right here. Ed's on the phone call. Ed's our self-advocate consultant in St. Lawrence. He's been participating in the legislative days supported by the Alliance and the Arc of New York. We are setting up some visits with our legislators. We have them set up with Ken Blankenbush and Senator Ritchie's rep and Mark Walczak in Jefferson, and the MSO group up north, which is Clinton ARC and Mountain Lake Services, and the Arc of Jefferson St. Lawrence are going to be meeting with some representation up there also. So
yeah, I sent Cuomo a Christmas card with a 2-page letter. And the commissioner, a Christmas card with Sasha's, all the places she's visited on the Christmas card, and a 2-page letter about that therapeutic rate leave cut.
Great, appreciate it. So we'll be getting some more sessions together and more advocacy, sending out a template. But advocacy works, and you know, not so much from me or the staff that work at the Arc of Jefferson, but from family members and the people we support and our staff advocates. They're the ones that really make the impact. So we'll get more information out about that. You know, some of the other the only good thing about COVID is some of the restrictions for telehealth have been eliminated or reduced. So that's become much more viable as an option to provide services. We want that to continue. There's a lot of things that we don't know that's not shared with residents of New York State or with providers about some of the issues behind the door on budget transparency, and that's being asked for. And we're really continuing to promote the workforce. We really need, you know, we still are not where we need to be. Our staff deserve to be paid a living wage.
Yes.
And other than be fair to direct care and the minimum wage increases, minimum wage helps the bottom, but it doesn't help anyone who's been here for a while because we don't get funded for that.
Right.
You know, we just got minimum wages went from on December 31st, went from 11.70 to 12.50 an hour. So we got support. We're getting support from that from the state to pay for that, but we're not getting anything for anybody above. So we did an analysis of trying to do a regressive scale with the low end getting more, all the way up to the high end getting something, and it would have cost $900,000. So
Mhm.
we are going to, you know, continue to look at our finances, and at some point, if we can, we're going to try to implement that. But I will tell you that our budget, all those combined cuts are about $1.7 million to the Arc of Jefferson St. Lawrence.
Mm.
So, you know, those cuts based on top of limited support over the years and some of the other things that have gone on continue to erode our services, and we need to continue to advocate strongly. Our
Mhm.
budget for 2021, 22, or 2021, excuse me, the agencies has a $395,000 deficit. So it was very difficult to try to come up with what's going to happen in regards to revenue. So we're taking a close look. We think we'll be okay. We're taking a close look at revenues. We're taking a close look at expenses, and we'll continue to monitor on a monthly basis. You know, this is a rate, what they call a rate rationalized year. So if the state goes through with what they've been doing historically, whatever we end up with at the end of the year, if we end up with a surplus, they would reduce our rate. So we want to make sure that we spend down in this given year anyway.
Mhm. Mhm. It's so discouraging.
Okay, so let's see, we'll stop that share. So I want to open it up to the group. If you have any questions, or if any of my staff want to bring up some issues that are going on. Lori, do you have anything to say about the nursing or any of the supports?
Well, basically just that, what a good job the staff have been doing, keeping folks safe, getting people in to get their shots. I figured out today that we've had 115 people in Jefferson that have gotten both doses. So that's kind of encouraging. Just trying to get more staff in there, so.
Is Karen on? Karen Jarvis?
Mhm.
No, I
No.
don't think it's Howie.
Okay. All right. Laura, Lynn, did you have anything you wanted to add?
No, just kudos to our staff. They've done an amazing job. It's been a long year, and they've done a tremendous job keeping everyone's loved ones safe.
Mhm.
So with that, just another thing on the budget. Let me see if I can pull that up. Just to show you guys a little bit.
Mm.
1 second.
I have a question at the end, if you could hang on, Howie, please.
Yep, 1 second. I'm just trying to find my budget's not coming up for some reason.
Mm. There it is.
Can you see it?
Yeah.
All right, so this basically is the budget for the Arc of Jefferson St. Lawrence, just to give you an idea. So if you look at the residential cuts up there in the top under revenue, that's about $600,000 with the change going from July to May 1st, where those cuts were going to be put in place. The 1% cut, I did a 2% just to be safe, and that's about the $888,350 there. We are looking to fill about half our vacancies. So if you see that number, that 208 over here, 963, that equates to filling half the beds. And that's added back into our projected revenue. So Medicaid revenue right there is the $43 million. What we did was, we're looking for a few things like food stamps, for example. We anticipate about 3% increase there. Room and board about a 3% increase. We're hoping that our UPS sales will go up 5%. They continue to do fairly well. Our printing, our evaluation revenue from the preschool, and on the very bottom here, this $90,000, that's for additional business that we're picking up for our work centers. So, we tried to take the budget from 2020 and then look at what our experience was with COVID and then extrapolate it forward. So our total revenue, it looks like at 69,000 or 69,632,000. And our staff costs are about 40 million. And then all these other things here, which are normal conditions. One other difficulty putting a budget together is we have two separate accounting software platforms right now. We're moving to one, but we're not quite there yet. We are going to be eliminating a marketing person, our marketing staff. A person in Jefferson is going to be retiring, and we're not going to fill it. We're going to be, Michelle Quinnell will be taking on that responsibility, and Michelle Carpenter will be taking on some of that too. And Michelle Quinnell's staff up north will be assuming some additional responsibilities. If you see on the budget here, physical plant upgrades, that's about half of what they put in for. We're just looking at doing critical. Transportation, that's basically for replacing vehicles in St. Lawrence County. We've been doing it for the last 3 years. And this year is more wheelchair vans need to be replaced. And then IT, they wanted about $1.5 million, and we're looking at about 600,000 being invested there for both counties. So our total expense budget's looking at 70 million. So a deficit of 395. Just to show you a quick synopsis of that. Okay, I'll open it up for questions.
Oh, I have a question. You mentioned food stamps, and I don't think I asked about food stamps for Sasha at her house, and I don't know if she's receiving food stamps. And
Yep, everyone in our residence gets food stamps. They all get a different amount,
really,
and it goes towards the grocery bills. Yep,
so Sasha does have food stamps. I didn't know.
yep. Some of them don't get a lot, but it's not a lot. Per location, but it helps with the reduction in the food costs.
Okay. If I wanted to check and make sure she had them, who would I ask?
Tammy in residential takes care of that. So you can reach out to Christine Lozon or Tammy Stiles.
Okay.
Be able to tell you.
Okay, thank you.
I was wondering about the Canton Day Hab. You said it was going to be open. Will it be open for the people that are living at homes or open to like the Minor Street group also?
Right now it's only open for people that reside in the community or they're with another provider. It's very limited. We're hoping as the numbers continue to go down that we can expand the number of people coming into the locations.
Okay. And you said that they could go home, but if they got to go home, it would have to be with a conversation with you?
Well, with me or with the residential staff, but Tara's on here. Let her talk a little bit about it. But we do have protocols for going home. But I have had parents call me personally, probably 4 or 5, and I asked them a series of questions other than what's on the protocols. Right now the community spread the way it's been, I'm very reluctant unless I feel very secure that the family member's been vaccinated. They don't go out in the community. Nobody else is going to be in the house. Those kinds of things have to be answered appropriately. I can't stop you. I mean, if you wanted to take it home, but
they need to be able to go back if they come home. So I know that's a risk. So I just want my daughter who's listening to this meeting to hear you say that. She's ready.
We're hopeful that, with more people getting vaccinated and some of the precautions we're taking, that the numbers will start going down and we can start having some form of normalcy here. It's probably not going to be normal for a long time, but at least we can start, looking at some of these, like we did before, relax some of those restrictions.
So if the okay, I'm sorry. Go ahead.
Go ahead.
No, I'm okay.
Add about the day program. In our teams in Jefferson County and St. Lawrence County are meeting on Friday and then next week on Monday to look at a reopening plan that is safe for all the individuals returning. So once we put a definitive plan in place, we will share that out with families either on our website or through another town hall meeting.
Okay.
Okay, website.
You can say hi.
I gotta update it.
Howie, I was wondering about, is there been any talks of rapid COVID testing in the residential home, making it easier for them to go out and visit? To go home or?
There's been some discussion, but right now, we haven't looked at that. And one of the, I think Lori can talk about this, but I think we don't feel secure with the rapid tests that are out, that they're reliable for in the home.
Right now, a lot of the rapid tests anyways, they're sending out if they show up negative because they're not, they give a lot of false negatives.
Right. I understand they're using it downstate further, way further. I was wondering, I think several places are using it, but not around here, obviously.
So if I was to get, my first shot's going to be the 19th. If I got both shots, would it be more likely that my daughter could come to visit? She's had both her shots, but I guess I'll just check later with that.
Yes. I mean,
once I get.
if you had both your shots and your daughter did, and you're past that month wait period afterwards, and it probably, it wouldn't be a problem. The only issue that we'd be concerned about is there's a probability you could still be a carrier, even if you're not going to end up being positive.
Okay.
So
got it.
You just want to make sure that you're being safe, which I know you probably will, when you have your daughter home. You're not exposing her to other people or large groups in the community. But
no.
yes.
Yeah. Thank you. Somebody
Well,
have a question?
Yeah, I'd like to piggyback on that if I could. I have a son currently home that's in an IRA house, and I took him home because he was locked down for a month and I wasn't given visitation. He's had both of his COVID shots now. Me and my wife have had our first shots. I guess my question is, if I wanted to bring him back, what procedures do I have to go through to bring him back?
Tara?
What we've agreed upon to allow for folks to come back is that they have to demonstrate a negative COVID test.
No.
And then also demonstrate that they have not been around anybody for the last 14 days that have had symptoms of COVID.
Okay. There was a procedure in place at one point in time in the house that my son was in, the IRA house, to where if he was home less than 3 days, that if I had a COVID test, that he could come back, as long as I wrote basically who he was in contact with. And then that procedure stopped to where everybody was now locked down. And that's why basically after a month of him being in the house without visitation, I brought him home. So he's been home 2 weeks now. And of course, he's anxious to go back because that's home, but he's not able to do that because of the restrictions. So I guess my question is, and I know and I understand everything. And by the way, my name's Ralph Frost. Matt Frost is my son.
Okay.
And I'm sure y'all know Matt or know of him. But anyway, yeah, he's anxious and at the bit to come back to his IRA house. And of course, I can't take him because of the restrictions. And he's had both his shots and he's had them for 2 weeks now. And I guess my question is if he wanted to come back, I think you've answered my question that if I provided a COVID test, he could come back. But then point two to that, if he does come back, then basically he's in lockdown again until we don't know when.
They're all in lockdown.
Yeah. And I guess that mirrors the part two question, of, I don't know. So you're saying if I want to bring him back, then I can bring him back with a COVID test?
Yes.
Okay. Yeah, that's all I needed to know. So.
Yep.
All right.
And we'd be happy to
Hopefully
have him back.
His house is on and they're listening, so.
I think it's also important to note that some of our restrictions do come down from the state. So we certainly want all of our family members to see their loved ones. But we also have people that are telling us some of our restrictions. So we factor all those things in when we make decisions.
Well,
Mhm.
plus the staff, you never know because people are coming and going too. So
Right.
when the staff, you know, that's a concern too, that they're going to give something or get something. So, you know, I understand the reason for the lockdowns, but it is hard on them.
Right, and I understand. I concur with you. And
Mhm.
yeah, because there was, you know, I'm not trying to get to, you know, I don't expect the, you know, Matt's used to coming home every week and we got used to bringing him home every 2-3 weeks. I mean,
Mhm.
even if we could get to that point and with a COVID test, I think that would be a little easier. But I also part two understand the fact that we're concerned with the fact that it's still rampant right now and people are
Yeah.
still vaccinated. But it's
Right.
tough on parents. And I know any parent on here right now that has a child that's, you know, locked down in a house, you know, and they don't understand why they're not able to come home. I mean, that's just a really tough thing to deal with.
Yeah.
Mhm.
In Chrissy's group home, it's been a blessing that they've had Dahab come to the house. So
Mhm.
during the week, she's busy, you know, she stays busy. I'm surprised that she's doing as well as she is. But that's been a blessing to have them there.
And we understand it's been challenging for not only family members, but for the people we support. They've basically been prisoners for a long period of time before we had some reduction in restrictions. And then all of a sudden the numbers went back up again and we had to pull back. So we understand. We've tried to provide more activities for the locations. You know, we're eligible for grants from the Arc of New York for recreation. And each of our counties got 12 grand last year. This year we're getting 18,000 each. So we've kind of concentrated on things that we can buy for the houses that they can do in the locations versus having to go out in the community. Bought gift cards so they could get meals at restaurants, take out, those kinds of things. So
Right.
the staff have been innovative in what they've tried to do because it becomes boring after a while when you're staying home the whole time. And I know that they miss coming to program and they miss being with their friends.
Yeah. Staff has been great.
Yeah, another thing with Matt too is that basically he was working over at your Productions Unlimited facility and then he basically lost his job.
Right.
And they're in the process, I guess, of trying to, so on top of not going to work every day and then being locked down to where he isn't able to come home. And then with his disability of not understanding the situation and why, you know, all of a sudden his routine is messed up. It's been really hard on him. So that's.
So Lynn, do you want to talk about the workshop?
Yep, this is Lynn Petrosky. So I oversee the workshop and I can't speak specifically to Matt's situation. I'm wondering if his funding stream changed and if that's the case.
It did. And I know Miss Brennan's working his case.
Good. Okay.
But
Then
we're still waiting. And that's another thing that's itching Matt right now. I mean, he wants to go to work and he can't go to work because he's home and I can't take him back because, you know, if I take him back, then he's in lockdown again. So, I mean, it's just it's like a double-edged sword for us right now.
yeah.
And as long as he's not working, then I see no reason to bring him back to the house because he's going to do the same thing at the house as he does here. But at
Right.
least here he's able to be with us. So
I can follow up with Ann tomorrow and see what she's waiting on, and have her reach out to you. And if he can come back to work and he's going to return to the IRA, then he should be able to be back to normal programming. I would say.
Yeah, and I think that's the biggest thing for him is because he was a month in the house with no work. And he's very regimented because of his disability. I mean, he has a routine that he does every day. And when you take that routine away from him, I mean, it really is, it's tough on him. And so he was having a hard time basically being stuck in the house. And he, you know, for the first time ever, he basically asked me to bring him home, which he never has done before. So, and I was shocked to hear the fact because he loves living where he does. And you guys do a great job. First of all, let me commend everybody, you know, in the Ira house that takes care of my son because they do an awesome job. Kat does a great job. She always keeps in touch with me. But it's just, and that's the biggest thing I wanted to get on the call. And I'm sorry if I'm duplicating things you talked earlier because I come in late. I had a terrible time getting on this Zoom stuff. But anyways, but yeah, I just appreciate everything that you all do for us.
So Lynn, do you want to talk a little bit about why some people were faced with that?
Yes, so basically in simple terms, there were two different pots of money. And the one pot of money went away and some people had to be enrolled into a new program. And we are in the process of doing that. There were, I believe, 15 people in Jefferson County that were affected by it and 2 people in St. Lawrence County. So I believe that 90% of the people have been enrolled into the new pot of money and the new services. So they should be returning to programming relatively soon if they haven't already. So I'm certainly going to check on Matt tomorrow to see where we are in the process.
Yeah, last time I talked to Miss Brennan about it, she told me that she was aware that he had been approved.
Oh,
But
good.
yeah, she just was in she's got a backlog too, and she's just in the process of pushing, you know, get to that point. But she told me she didn't expect it probably till mid-February. So, but we're getting close. So I'm assuming she said she would call when she did find something out. But, but yeah, definitely. So like I said, I just appreciate it. So.
Any other questions?
Yeah, when does COVID stop?
Buy a lottery ticket. Ed, did you want to talk a little bit about your advocacy today? You're on mute.
Stop doing it. Oh.
You got to unmute, Ed.
Oh.
Ed,
Are they there?
do this.
So we have hired 2 self-advocate consultants. They are, Ed's job in St. Lawrence County is to provide support and training to people with disabilities and to be an advocate for them, to address issues, to go to legislators. And then we have Heather Romanak is the counterpart in Jefferson. We have a long history of having a self-advocate consultant. David Liscombe was a long-term self-advocate consultant here in Jefferson. And Andrew Nicholson was after that. Andrew now works for OPWDD in Albany.
Wow.
They took him away from us.
Wow.
Okay, Ed, you want to say a few words?
I doing fine. I know what the family's going through. I am there with you. I wish this thing was over myself. So hang in there. I got my own office too.
So Ed's on the family committee for Life Plan, which is a care coordination organization. He's also going to be active with the Self-Advocate Association of New York State. And we're working with him to have a talk show also at some point. So
awesome.
any other questions?
Howie,
Yes.
I just wanted to say for myself and my sister Kay, we appreciate so much everything that you and all the staff do because
yes,
it is just awesome, and we can't say enough about what a wonderful job you all do.
Well,
Yes,
I agree. I agree.
agree.
It's just amazing.
Yeah, thank you.
I'll buy a brick.
Yeah,
Great job.
How much do they cost?
They're $100, but one thing we are going to do, if people people don't want to buy a whole, we're going to list of some staff from the past who have left the agency or passed. And so in recognition, if people want to chip in to buy a brick in their honor, they can do that also.
Okay. I'm sorry, I interrupted somebody who was talking. I don't recall who.
Okay.
Yeah.
Anyone else?
The Minor Street girls have a question, Howie.
Okay.
Go ahead.
So if you're saying that, our parents have to get the vaccine first before we're allowed to see them?
Not necessarily, but that would be the best move if they got the vaccine, at least one shot, and had the 30-day period afterwards.
What if your family don't believe in it?
Well, I mean, we can talk to your family if at some point here soon when the community spread starts going down a little bit. Okay.
Can't give it.
There's still no visitation at the house, at the Iris?
No. Nope, and we're very restrictive. The staff that work in those locations are limited to one location in most cases. Very few work anywhere else unless it's an emergency. So we all know that community spread's coming from the community. In most cases, that the staff have brought it in. And overall, I think we've done fairly well, and the staff are pretty diligent. The numbers, you might think the numbers are high, but we have 1,400 staff. So when you look at it that way, our numbers are relatively low. But we are concerned. We've had weeks where we've had a lot of people quarantined or in isolation, both the people we support and the staff. So it's been challenging.
I will
And
say
my
this.
only
Oh, go ahead.
concern is the low percentage of staff getting vaccinated.
That's ours
Because
too.
that's going to prolong this. And at this point, our family has a higher vaccination rate than the staff does.
Yep, we're working on that. It's another high priority. We can't mandate it at this point in time.
Right.
But we can encourage, we're encouraged. So we're trying to give more information and education. We're trying to make it easier by providing hours so they get the vaccine done. And then we're providing the opportunity to win gift cards if they get vaccinated for the next 8 weeks. So.
I have a question for one of the individuals at Minor Street.
Okay.
What if their parents have been positive for COVID and they cannot get the vaccine and the individual has either had the vaccine or has been positive? Can they go on a home visit?
Well, it's all going to depend. It's going to be down the road, but if the person's been positive, they've already, and it's been the 14 days afterwards, they probably have built up some immunity to that. And the same thing with a family member. So we'll have to look at a case-by-case basis, but at this point in time, we're limiting those community outings based on it being brought back into the house.
Thank you.
Yep.
Yeah, the staff has been really good in Herman. It's just, they've been so good. Thank you.
You're welcome.
Mm-hmm.
Okay. Anything else? So we will put out a recording sometime tomorrow or the next day. We'll also put out some information regarding our legislative initiatives on our site. And if anyone is interested in meeting with legislators at some point, just let me know, and we'll set you up when we have those sessions.
Oh, sessions will be on Zoom or something?
Yep, they're in Zoom.
And the legislators would be who, like Patty Ritchie?
Well, we're meeting with, this week, we're meeting with Sarah, Patty representative, not with Patty. She couldn't make the meeting. But we are meeting with Mark Walczak and Ken Blankenbush. And then up north, a group of directors are meeting with representatives from further up north that cover part of St. Lawrence.
How do we find out when these, if we wanted to be part of it? How do we?
Just let me know if you're interested. I mean, these ones are rather, they're occurring here soon. I probably let 1 or 2 family members, if they're interested, just send me an email. I'll put my email up on the
Yeah.
chat box here.
Yeah, I'd be interested.
Um,
I mean, I don't know what I'd say, but I'd be interested in hearing what they have to say and, you know.
So what we'd want to do is, where's that going?
I don't know.
It's not moving.
Do you want me to just call or something about?
Yeah, you can call me.
Is it going in?
Okay.
I can put it in for you.
I'm trying it now.
Howie?
Yep.
This is Nancy Charlevoix. At the beginning, you gave some stats about those that have been given the vaccine, and I think you said 20% of the individuals had received the vaccine, or was that staff?
No, there were 20% was staff in Jefferson, and it was 52% in St. Lawrence. So as of last Thursday, for employees, 254 out of 761 had it completed.
And why is that, Howie? Are the vaccines available to the employees? Are people reluctant to get it because they're
Well, we actually did
afraid to get the vaccine?
Yep, Lynn did a survey prior to the vaccine becoming available. It's pretty much held consistent. They think it's too new, not enough research. There's a few people with medical reasons, but that's limited. So it's mostly just the unknown, being new, and fearful.
Yeah.
That's why we're trying to do more education.
Yeah, I know you said that. Well, I hope that number changes quickly. My daughter happens to work in a profession where she's had to get the vaccine. She works in foster care. She's had both. I understand people being a little nervous, but I'm afraid that we're not going to wipe out this virus if we're too reluctant to get the vaccines.
Yep, there has to be at least, I think it's 60% is the low end, 75% community herd immunity. So
yeah,
it's important that a large majority of our staff get it done.
And you're saying, Howie, that you're just relying on the community spread numbers as your determination on opening back up visitation is going to be dependent on the community spread, not on employee vaccination?
Yeah, mostly community spread. That's what we did last time. So as the numbers started to come down in the community.
Right. What's your magic number? I mean, I'm not trying to put you on the spot, but what's the magic number on percentage community spread wise before we start loosening?
We really didn't pick one. We just looked at what was being reported on a weekly or a daily basis, and when those numbers started to get real low, we looked at then offering the opportunity for visitation at home or even in the residences. But visitation in the residences is going to be limited for quite a while, I would assume.
Okay.
Yeah.
How will we tell when it changes? Will the parents get notified or what?
Yeah, once we have a change in our overall policy, we will notify everyone either on our website or the QIDPs will be calling you.
I heard in St. Lawrence County, it's 5%, which is pretty high. And they said it's one of the highest in the state, supposedly. I don't know. 5% is pretty high.
Yep.
5% for what?
5%. I don't know how, it's just, that's the category. They want it down to 2%. That's probably, the lower number of people that would have it in an area. 5% is high.
The good news is the ARC, so, our stats go into all the other chapters. So the main office in Latham, they compile all the ARCs across the state, and our numbers are starting to go down. They're as a report of today, we got a copy of it. They're close to where it was in July. So they are starting to go back down again. So
that's good.
The good news is the numbers are going down slow,
Good.
but sure. We'll have to wait and see what happens.
the statewide positivity rate right now is 5.12%. So, Howie and all of us as senior team members have different meetings with other agencies across the state. So collectively, we're kind of bouncing ideas off each other, like what would be that percentage? So it is something that we're looking at. And I mean, I don't think, like Howie said, he didn't have a magic number yet, but that is something we're gonna look at, maybe determining what is that number that we would start opening more and more.
Well, things were pretty good when it was 2%. We weren't so worried.
I mean, we're going to be wearing masks for a while, even as those numbers go down.
Right.
Right. I mean, we just never want to get, to the point in time to where, mass hysteria is going to dictate that we don't do anything. And I just don't want to get to that point to where, at some point in time down the road that we don't start reopening back up again.
Yep.
Yeah.
Okay, well, thank you very much. If you find these helpful, we'll try to set another one up in March.
I think it is helpful. Yeah.
Okay.
Yes, I would appreciate it.
Okay, so we'll let you know. We'll set another one for March. You can go to the website to get any updated information. And if you are interested, just reach out to me and we'll get you on a list to meet with legislators. We'll talk to you first about what the issues are, and you guys can come up with the real stories to back up why we don't need to go that way.
Yes.
Because the stories are what makes it.
I'm very interested.
Okay.
So I'll call.
All right.
Thank you.
Thank you.
I'll be sending Christmas cards, maybe summer cards to Cuomo again.
Oh, God.
Send him a Valentine's Day card.
I think I will. I'll thank him for extending it and hope that we could just extend it even farther, that we don't have to have that therapeutic rate cut. That would be nice. I tried very hard. I got a letter back.
Oh, yeah?
Yes. The commissioner sent me a letter too. Said everything was fine. Well, I don't agree.
No.
So the one thing that's not in the budget is managed care. There's very little mention of it. So,
Managed care. Just give me a managed care, meaning.
So managed care has been discussed for a number of years, that this is the way OPW is going to be going, where services are going to be managed by an insurance entity. In New York State, they're looking at,
like an HMO?
Yeah, but it's going to be provider led. And that's where all these CCOs are looking to form managed care organizations.
Got it.
That will be managing this level of care. It'll be moving from a fee-based service where we get paid for the service provided to a service based on the quality of service and programs being provided.
But that's the care coordinators do that, right? That's managed care.
Care coordinators are the first step towards managed care.
Oh, okay.
Just for a weekend.
Yeah, it's like the MSCs are managed care,
That'd be
right?
nice. We got the
The MSCs went to care coordination. There's a little
Right.
difference. A care coordinator is more heavily involved in a holistic approach, medical and program.
Got it. Got it. I don't know where it's going, if it's going to be good or not.
Hey, Howie,
Yes.
it's Caitlin.
Oh, nice to meet
Are you going to recommend the staff to get the shot if they don't want it?
No, we can't
Mandate
make
them?
we can't make them right now.
All right, thank you.
You're welcome. Good question.
Is that an eventual goal though? Because you're saying not right now.
There is talk, but historically, healthcare workers have been mandated, like in the hospital, nursing homes. We have never been mandated for flu shots and such. There is talk out there. I mean, our HR director was on a conference call today with Bonchenik and King that said that we could mandate, but I'm not so sure they're interpreting correctly for the field as a whole. So we're going to be looking into that more.
Yeah. Yeah. That's a hard call.
I don't understand the reluctance. to
There's
get
one,
vaccinated.
there's one staff that told me that she doesn't want to get it. That's in
You're not
Herman.
going home right now, are you?
It's
I
a
don't
personal-
understand. I worked in the school system. All the teachers that I know, everybody was anxious to get the vaccine. My daughter was anxious to get the vaccine. To hear people say they don't want it, they don't trust it, that scares me because I think that it's so important that we all get vaccinated.
Yeah.
You know,
Just
I
have
mean,
to do
polio vaccine was new. You know, everything's been new. You know, when it's first introduced, you know, there's some reluctance, but that is how we are going to get back to get back to living again. You know.
Yeah. This has to do with education.
So my email.
Yeah, I guess so. I
My
guess so.
email's up in the chat box now if you need it.
What's that?
Mm-hmm.
My email's in the chat box if you need it.
Okay.
Mm.
But I know that my brother Norman has had the first injection, due for the second one. Maybe he's already gotten it. I haven't been able to see him. And I think a lot of the individuals in his house, but I didn't realize until tonight that there were so many people reluctant to get it.
Yep.
Yeah. Yeah.
Yeah.
Yep.
How about you? Are you nervous about it?
Who, me?
I don't know who I'm speaking to, but are you nervous about it?
This is Howie. I wasn't nervous at all. I was just
Yeah.
waiting for it to happen.
Yeah.
Oh, you, Howie? Yeah.
Yeah.
Yeah. Me too. Me too. I mean, I'm 62, and I have some health issues, and I can't get it. I'm disappointed. You know.
You can effective Monday, core morbidity. If you have doctor's statement, you can get the vaccine.
Well, he suggested I get it. I have myelodysplasia syndrome, and I have asthma, and but I still can't get it based on Cuomo's, based on the government's guidelines. But you know,
Over here in Western New York, the supply has been a problem. Trying to
Has it?
find a place to get a shot, it's been horrible. But I'm hoping that with this new thing with the governor, I'm going to be up at midnight on the 14th trying to get my name on a list somewhere.
So we've been.
Oh, I have heard that here too. I have. Where are you?
I'm south of Buffalo, New York.
Are you? I have heard that too. Friends have called a lot of places to get.
I just kind of want to put a little note on everybody saying that staff is reluctant. It's not that we're reluctant. It's literally that most of us have already had COVID because we are taking care of individuals that have had COVID. And we're working day in, day out. I mean, some of us are putting in 70 hours a week, taking care of people. So a lot of us have already had COVID. And to get the vaccine, you know, a lot of them can't get the vaccine because they've just come out of quarantine. So it's not uneducation. It's literally just, we've had it, we have the antibodies. Or, you know, some people are allergic to vaccines. They cannot get them because they can go sepsis and die. Like, we're very educated. We do know, we educate ourselves to take care of people. That's why we're in this field, and we take very good care of your relatives, your family, everything.
Absolutely.
I mean, we love them like they are our family. You know, we're with them more than we're with our family right now. So we're not putting anybody in danger, but a lot of us have had COVID. So
I'm so sorry. I didn't mean to sound critical. My brother lives in a house in Dexter. I love that staff. Absolutely love the staff. And I'm sure you're all dedicated. You know, I've known people in the agency since the early 70s when Norman came back here. So I'm well aware of how well, you know, how devoted a lot of staff is. I don't mean to be critical. I really don't. I just, I guess I'm looking at how can we make people feel more comfortable, those that are not comfortable? I understand if you've had it, you've got the antibodies and they're going to say no. And there are situations where people can't get it. But I think just in general, just to educate, so that the more people that get it, I think the safer we'll all be. The safer you'll be, the safer everybody will be.
Yeah,
You
I
know?
didn't mean to be disparaging either. I just think it's just basic across the board education for anybody who's reluctant. It would be good if they understood that important part. I mean, the staff where my daughter lives, they're just great.
Yeah.
I think it has to do with just a certain amount of knowledge that they need to hear about how important it is. I'm not meaning to be disparaging.
Oh, nor me either. And I think was so much on the news early on, that would make people question whether it was safe. And that's
Right.
unfortunate. That was really unfortunate that happened because
Mhm.
anytime there's we haven't had it. We haven't needed a vaccine like this on this kind of level ever. So being first time for a lot of people, they're like, well, what do we
Yeah.
know? Do we know enough? But there's a lot of people out there that are very intelligent,
Mhm.
scientists,
So
doctors.
one of the things someone just put on here is connecting with other family members. So we've had family groups in the past.
Oh, okay.
So we could facilitate setting up Zoom meetings just for family members to talk to. Which we could do a little presentation and then leave it to you guys to talk about what you want to talk about. So
That was not a bad idea.
Yep.
Thanks, Howie.
Yeah.
We moved to Watertown 3 years ago, and we lived in Franklin County, and so it's hard to connect once your kids are out of the school system. And she's in Madrid, actually not Canton, Madrid, but goes to Canton Day Hab. So it's just really, it's so challenging to try to find other parents when your kid is an adult. I mean, that's just life, I guess. But I would love to, meet with other parents or talk with other people. And
I think it's a great idea.
Yep. So we can facilitate. Is Michelle still on here? Michelle Quinnell?
Howie, she had to drop off. She was having connectivity.
All right. So we can work with Michelle to, try to facilitate a family advocacy group again. That'll help us with our advocacy period too, not only for you guys to talk with each other, but also look at issues that we can address on a regional and statewide level.
Yeah.
Okay.
Thank you.
Yeah.
Okay, guys.
Thank you very much, Howie.
Thank you.
Thank you.
Yes, thank you.
Thank you, Howie.
Talk to you
Thank
later.
you. Good job.
We'll get you a message out for our meeting in March.
Okay.
Okay. Good
All
night.
right, thank you. Good night.
Night, everybody.
Night,
Good
night.
night.